Hey y'all, I'm back again. Hello, if you're new to my channel, I'm Roz, and today I have some rambling to do. I need to change the title, and I say that every time I go live on Rambling Roz, but Rambling Roz is um where I talk about random things that are on my heart or I feel led to talk about that is going on in the world or just with me personally that I want to share. And of course, the most important thing is for me to have a platform where I give God the glory and I speak about Jesus. Um, if you are not subscribed to my channel, I encourage you to hit that subscribe button and to hit the notification button so that you know when I'm live. Okay. All right. Also, I just posted a video about Good Friday and what it means. So if you are interested, go ahead and click on that video and watch the replay and give a comment on that one or give a thumbs up or whatever you choose to do. Just make it respectful, please. So, right now, and I just wanted to separate that video from this one because the other video is all about the Lord. Okay. And so, this video is kind of an update on what I've been, well, it's not an update, but I just wanted to, I just felt like talking to y'all, darn, basically. But no, I have been going through a lot. That's why I have not been going live lately. Not only have I been busy, just with life, with school and work and everything, with my grandson, everything, but also I've been very, very sick, y'all. I've been very sick, and no, not with COVID this time. And as of right now, neither I or the doctors know exactly what the issue is. So I've been undergoing a lot of tests, CT scan, X-ray, blood tests, urine, you name it. So and so that I have not been going live mostly because I have not been feeling well. I have not had the energy, and I've never felt this way before. I feel like this is different for me. And this all started back in March, like the first week of March. And I finally emailed my doctor. Um, I believe it was 3 days before the 13th of March. So, yeah, like around the 11th or on the 10th of March. And now here it is, April. Yes, we have an interference here. Sure, knock yourself out. All right, so I've been so sick and so tired. So if I seem a little bit discombobulated, it's because I don't feel like myself right now. I have not even had, I've been having these terrible abdominal cramps. And I don't even know how to describe it. It hurts, but it doesn't. It's just the weirdest thing. But they are pretty much constant, and they're worse if I move around or especially if I stand up for if I try to stand up for a long time or walk, I really feel it. So it's kind of this. It started in my pelvic area, So like the lower abdomen, it started off as just kind of achy, and I've had a bladder UTI before, which is a bladder infection, urinary tract infection. I've had that before. A lot of women have had a urinary tract infection before. So because I've had that before, um, that's the way it. I thought that's what it was. That's the way it felt. So the first thing I started doing was like, okay, so I just started drinking cranberry juice, which I have to be careful because I have GERD, so I get acid reflux really bad. So I had to be careful. But that day, my stomach was really bothering me. So my first thought was to, excuse me, was to drink some cranberry juice. So that's what I drank, and but I was still hurting. I was still hurting really bad. And then it started becoming more crampy, like crampy, almost like menstrual cramps. But I had a hysterectomy, so I know I don't have that going on. And it was just this constant kind of cramping, and it started moving from the front to my lower back. So I started putting a heating pad on it at night to so I could sleep, and it helped my back feel better. But then it seems like then at some point it felt like my stomach started really cramping, and so I tried putting the heat on my stomach, and that didn't feel good. That made it worse. So I didn't do that anymore. And one day, there was one night where I was so sick. I mean, the cramps were like squeezing real hard, and it was hurting so bad. And I was moaning and groaning, and even my husband noticed that I was not feeling good. And at first I thought I was going to vomit. So I asked for him to bring a bowl in here, but I never vomited. I just felt nauseous. It was just horrible. And so I started thinking, maybe this is a little bit more than what I'm thinking it is. So I emailed my doctor about it, and so I went in to have a urine test to check for bladder infection. And so I actually do have a bladder infection. So I have started antibiotics. So hopefully that will make me feel better, because right now, like I said, when I when I get up, oh, I feel like I'm just drained. Like I feel like my legs feel like jello when I'm trying to go down the stairs. And coming up the stairs, I feel like a sack of potatoes. Trying to lift, my body feels so heavy coming up the stairs. And then when I get up in the morning, when I first get up in the morning, I try to have a good attitude, and I just try to get up and not think about it. And maybe if I don't think about it, you know, I won't be cramping. But the more I move around, it starts coming back, and then I realize, okay, it's still there. Today I had to go in the store to use the bath. I had to use the bathroom really bad. I had dropped my husband off at BART, so I went to into the Target to use their restroom. While I was in there, um, I decided that to go and get some bathroom cleaner because I was all out of it and I really needed it. So I walked as I started. First of all, I got a basket to lean on, and as I started walking, gosh, I just felt so sick, like my body just does not feel well at all. And whatever is going on, it's affecting my whole body. It feels like I have a really bad flu, or I don't know, y'all. I just do not. I feel very unwell and kind of foggy headed, and can't remember things that I normally can remember, like brain fog and stuff. And I've been very irritable, very grumpy, um, not really feeling like sitting on the couch in the living room, just wanting to sit in my bed and all day, basically. And I've been, since I do have the bladder infection, I have been making an extra effort to make sure that I'm drinking at least 64 ounces of water every day, which normally I'm dehydrated. But lately, I've just been making myself drink that water, okay, which I need to do right now. So, and of course, oh, I'm tired, y'all. So, of course, that's been making me get up and down all through the night and go to the bathroom. But I'm so tired, I just fall right back to sleep after I get back in the bed. But I've been so tired, like I have to force myself to get up, to take a bath, and just to do normal stuff, to wash dishes. Oh my God. Washing dishes is so exhausting. Trying to cook a meal is so exhausting. I was trying to make myself like a vegetable soup with chicken broth and just a whole bunch of different vegetables, and I chopped them up, put some turmeric in, some ginger, different spices and different things in there. And as I was trying to make that soup, I was just feeling like I was just going to collapse, literally. So every now and then I'd have to lean on the counter, you know, just kind of lean on the counter and just kind of moan and groan, and then get back up and push through it. And my poor daughter, my teenager, she was like asking me, "Why are you cooking? If you're feeling so bad." But, I felt like I had to. I mean, at least I wanted to make a big pot of that um, vegetable soup so that I could eat on it. I didn't have to worry about really making meals. I could just go heat that up and eat that. Kind of detox my body a little bit. So I got through that. Soup came out good, and I ate off of that for a couple of days. And so, another thing that's potentially going on with me is I also had my pap smear and the a cancer screening, and that came back abnormal. The test came back abnormal. So it was shown that I had HPV. Um, when my cervix was swabbed, it showed positive and high risk for HPV. I don't know I can't think of what. Oh, it's human papilloma virus, and that virus, um, from what I understand, is if you get that virus, that increases your risk of cervical cancer. So I guess that is why they have a vaccine for young people. So I believe all my girls have had it. It's supposed to protect them from that virus, which can um, lead to cervical cancer. So they want to do a biopsy of my cervix. And I've been looking at videos and stuff about that and horror stories. And I know some people personally, one of my daughters had it done. And I've just heard that it is extremely painful. And I've heard of women that cried through it, screamed through it, and okay, that's enough for me to not be uh, quite enthusiastic about having it done. I am uncomfortable already, and I don't want to go through that without pain medication. I'm going to need some pain medication. I'm at the point where otherwise I'm not doing it. I'm just not. So, I discussed medication with my doctor, and she has agreed that we will discuss, before the procedure is done, pain management options. So, I'm probably going to need something that day for anxiety because you know what am I to think? I've never had that done. Okay, so I'm more feeling anxious about being uncomfortable and the pain. So then I am worried about the actual diagnosis. So y'all pray for me. Pray for me. Pray for me. Because I can't see myself going through that without any pain medication. And Tylenol is just not going to get it. Now, I have read that if you take ibuprofen, that will lessen the pain, but I am allergic to ibuprofen. I can't take ibuprofen. So the only option that was given to me is Tylenol. And I mean, when I used to have menstrual cramps, Tylenol didn't help me. It was that ibuprofen. Those are over the counter medications, but they work differently in two different ways, okay? Tylenol is something that you can take like for headaches and I think for arthritis. One of them is like an anti-inflammatory, and one of them is something else. Okay, feel free to go look it up on Google. And I'm gonna have to speed this up because I gotta go to the bathroom, and I do not want to hold my bladder. I do not want to hold it, but I should get up and go, and I think I will because I just heard the bathroom door open. Y'all, hold on. I gotta take care of my health. Get yourself a glass of water, okay? I'll be right back. Mom, I'll be taking it on a little bit. You heard me? I said I don't think they put almond milk in it. I don't think they put almond milk in the drink. All this time.
my body was established. But I'm saying I don't. They didn't knock it off of that. It did. No, nothing to that. Oh, really? Yeah, I didn't know. Oh, I am. I mean, not on Zoom. I'm on YouTube. That's even worse. It went out all over the world. I'm just, yeah. Like, yeah, I'm going. I was my third time. It's not diarrhea. It's like normal food, but it's just like I'm going. I'm like, so good on. Yeah, it feels like a trick. My stomach started to bubble. I was like, oh my god, oh, well, well, I got bubble guts real bad. Well, they fixed mine, right? Because I have it. Okay, go ahead. I need to take a 2 hour shower. No, I'm gonna try to get quick this time because I don't want to study. And I've been understanding my mouth, so I put my classes. This exam. Oh, just think about it. Every grade that you keep on, those are points, those are credits. Well, it's not a test, it's an exam. That's like this date test. Oh, this is important. Oh, it's just my grade, just juniors again. So, again, I get out early too. I leave out 9. We will remind me, or let you know. Yes, I gotta get to school at 8. All right. Why in here?
All right, hey guys, I'm back. I'm back. Pardon me. I know these do not match. So what, y'all? Oh, oh my bladder hurts. Oh, my bladder hurts, y'all. Oh God. Oh. Welcome to the Ross Show. I'm back. I just had to go to the restroom because I have a bladder infection. I don't want to be holding no pee and no bacteria. So, oh God. Anywho, where did I leave off, y'all? Going to hit that subscribe button. Would you please have some mercy on Roz and pray for me, okay? All right. So, since I just pee, I guess I gotta refill. I can't stand water. Sorry, Lord. All right, so sorry, I got a bubble, like an air bubble. Excuse me. So where did I leave off? So as you can see, I've been miserable. I've been so miserable. It's going on. I feel like it's going on almost 6 weeks. To tell you the truth, no, it's not. Um, at least about a month. Oh, so, oh, okay. So I have to have a cervical biopsy. That is in May. So that's a little ways far off, but I don't mind waiting on that because that's something that I'm not looking forward to doing, to tell you the truth. And then to go through all of that pain for them to say, "Oh, everything's normal." I was like, "Huh? You better find something for me to go through all of that." But that's the opposite of how I should feel. I should feel relief, okay? But I just don't. I don't. Nobody wants to be in pain. So pray for me. And once it's all done and everything, I'll let you know how it went. But maybe it'll help somebody else. So I want to thank all the YouTubers that have posted their experience. Really helps a lot because sometimes the doctors they won't tell you that it's that painful. Um, and they'll make it seem like it's not as painful as it really is. If they scared all the patients away, then they wouldn't come in to get it done. So they have to kind of, you know, put it in a nice little package. So anyway, allegedly. so so that's one thing I gotta have done. Because we gotta check for the cervical cancer. So that's two things going on. I have a bladder infection and I have human papilloma virus. Okay, and then there's two more things going on. See, this is how my body acts. It's just my phone. When one thing is wrong, it seems like different organs in my body want to act up, okay? All at the same time. I don't know why my body is like that. It just seemed like multiple organs failure or whatever. It's like, oh, I don't know. But that's me. So I have two other things going on. My lipase, I don't know if I'm pronouncing that correctly, but it has something to do with your, darn it, not prostate. What is the other one? I always forget, and I wrote it down. Hold on, y'all. Pancreas. Pancreas. The lipase levels has something to do with your enzymes, either your pancreas or your liver. So my tests are showing up abnormal at the abnormal range. And so I've been doing some reading about that also. So, oh, okay. I'm trying to think. So I'm having an ultrasound next week. I'm having an ultrasound so they can look at my organs, take a look at my liver and my pancreas and everything with the ultrasound. I already had a CT scan, and it showed that I have a hiatal hernia. I forgot about that too. I have a hiatal hernia again. Okay, so for that, my doctor is telling me to make sure I am taking the heartburn medications. Okay, and acid reflux medications because that can exasperate it. So I have a hiatal hernia, and she said, and a lot of scar tissue um, inside my abdomen from just from previous surgeries. Like I had my gallbladder removed because I had gallstones. Okay, so and then I had a hysterectomy, and then I had a mass removed and my ovaries removed, child. Pretty soon I'm just gonna be hollow when I speak. No, my phone is ringing. Oh, that's an alarm. Never mind. When my phone's just going off, going off. Would you stop? That's my alarm reminding me to take my antibiotic. It seemed like I just took it. So, hiatal hernia, scar tissue, and the doctor did say that the scar tissue can cause pain too, which I didn't think. So I did read a little bit about scar tissue, and it said something about, yeah, it can cause pain because if you think about a scab and then the um, the dark skin that grows on over the skin, that is the scab. It's kind of tight, so that tightening inside your abdomen can cause, some pain. And the only way to treat that is surgery. And I'm like, I gotta have surgery? And she said, yes, surgery. I'm like, not again. So she haven't said anything else about it because we're still waiting on me to go and have the ultrasound done, and my another blood test done, and some other tests. I'm going to have another urine test also. So then hopefully we will come up with a diagnosis and a plan. Like, as long as it's something that's fixable, okay, and that the treatment is not something horrific, okay, and I don't need any. And then another thing, I don't want to do any more tests. By the time I get done, I seem like I have a CT scan of some part of my body every year. Because last year I had CT scan of my head, and then I had the CT scan of, I've had all kind of CT scans, y'all. That's probably what's wrong with me. Anyway, so they're going to be checking my pancreas and my liver, and they're going to look all up in there. So so I potentially have pancreatitis, um, and I don't know what they would call the liver issue if it is my liver. So I have been instructed to not take any more Tylenol. I was even taking muscle relaxants that I just had left over, thinking that, well, those spasms are muscles contracting. So I'm thinking if I take a muscle relaxant, then I'll get some relief so I can go to sleep. And it it helped a little bit. I'll say it helped a little bit, but I was gonna take that little bit because I was taking that every day around the clock, the muscle relaxant and the Tylenol to go along with it. And when I saw my doctor, she said stop all of that. And then she wants me to basically drink a lot of fluids, um, eat a healthy diet, and then she's gonna check my blood again to compare. You know, now she did check it twice, and both times the lipase and some alkaline something level was high, um, abnormal. So now I said, okay. So now what do I do? I can't even take the little. I already can't take ibuprofen because I'm allergic to it. You won't prescribe me anything like codeine or Norco, whatever the stronger medications are. Um, and then on top of that, now I can't take Tylenol or a muscle relaxant. What am I gonna do? I'm just gonna lay here and just die. So anyway, so I guess that makes sense that it feels like it's been getting worse lately. Is because I've stopped those medications, and those medications were helping me, I guess, a little bit. But Pray for me that I get some relief, at least just from taking the antibiotics for the bladder infection. Because now the discomfort is not just in my pelvic area, but now sometimes I'll feel a ache on this side, or in my upper back where my lungs or my kidneys are, or sometimes the pain will kind of go, sorry, kind of go up my stomach. I mean, it's just, y'all. So with all that going on, I haven't been able to function. I haven't been able to go to the gym, or do laundry. None of my regular stuff. So it is interfering with my life, with my daily life. So I will keep you guys posted of what the final result ends up being. Because if I can help somebody else who's going through the same thing, um, that that makes me feel good to be able to help somebody, because I'm helped by the videos that you guys put out, you know. So let me clarify that I am in no way a doctor or a nurse at all. Okay. I am not any of those. And it's been difficult also. Oh, and I'm also being referred to a specialist, a gastroenterologist, so a GI doctor. So they're going to be dealing, I guess they're dealing with I don't know. I'm seeing the OBGYN, my primary care physician, the GI doctor. So I don't know. Most important thing is that they know what their job is to do. So, oh, and one more thing. I just been kind of denial about this one. Do you know my doctor told me that I am pre-diabetic? Pre-diabetic. I thought I would never hear those words. My mother wasn't that. As far as I know, my father wasn't that. My grandmother, like I haven't heard of anybody in my immediate family except my brother recently. I don't want to tell his business. Um, of being pre-diabetic. And I guess I didn't want to really talk about that and make that known, because it has to do with the shame of eating badly. So, but I have cut out pretty much all junk food. I know I went to a baby shower and I had a tiny, like maybe barely a spoon of cake. Okay. But I've been doing really good. I have not been eating no cookies. Um, well, I did eat a little bit of the chips at the baby shower also. But other than that, I've been focusing on eating food, making sure having a high protein diet and trying to limit the carbs to maybe um, a protein pancake in the morning, which is whole grain, and I love it. So, and I actually lost some weight, and that's another thing. I put on some weight, and I'm sure I have. My weight is when I'm being disciplined and cutting out the junk food and going to the gym, then my weight starts going down. But as soon as I get off of that and I stop going to the gym and I go back to eating junk food again, then my weight is going back up. So it's like going up and it's going down. But which is not healthy for your body. It is not healthy for your body. Fix the hair. But and I'm ashamed to say that I had sugar addiction. I really believe I do because I crave sugar all the time. All the time. I could just live off of sugar and never eat a meal. My meal could be cookies in the morning, ice cream for lunch, chips for a snack, and cake or donut. I don't really eat donuts that much for dinner, literally. So I am not food mature. I haven't put away childish things. And I like candy, chocolate with nuts, chocolate, just chocolate, almond joy, Hershey's, Reese's Pieces, Reese's with the peanut butter. Oh, don't. See's candy. I love it. I love it. I love it. I love it. I like candy. So I haven't even eaten any candy. No chocolate. I did eat like a peppermint. I had I had this little pack of peppermints that I would eat every now and then. And I've been drinking this. So the only really sweet thing that I am eating, because I don't want to open up that door. I've been off the cookies and the candy for I don't know how long, but for a while. So if I'm on a roll and I'm like able to get through the day successfully with, without giving into it, I need to keep going. So I feel like I'm one of those, like, if you ever pick up a piece of candy again, you're gonna be hooked and you all over again. So anybody out there feel me? Comment in the comment section. Go right on ahead. Cause Roz is human. Okay, just like everybody else. And I'm being bold about it. Okay. Okay. I was gonna say ain't no shame in my game, but there is shame. Because you know how people judge you, when you're overweight, and I associate diabetes with somebody being overweight, but it's not always the case. But pre-diabetic, I do not want to have nothing to do with those insulin shots. No, 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 no. Mm-mm, mm-mm, mm-mm. I'm like, so that candy started looking nasty to me. Ugh. Every time I look at that chocolate, I think about a needle, and I do not like needles. So oh, my legs. So I have not had any candy since, or a cookie. And I was tempted today to go get a cookie from Crumble Cookie, if you heard of that. They have these huge, like gourmet type cookies. And every week they change them. They change the flavor. I think they have like four flavors. So they have like the flavors of the week. And they kind of go in rotation. And they have like different, I guess they try different flavors and whatever. But anyway, my daughter hooked me onto that. I would have never known about any crumble cookie until she brought them over here one day. They're kind of pricey too, but they so good. I feel like they worth the price, but not the price of your health though. So they say that to eat everything in moderation. That would be great if you can do that. But when it comes to sugar, I am not the one. But the only thing that I have been having that is been eating that is sweet is when I have my protein pancake, and I just have one protein pancake, the syrup on top. But my husband, he's a blessing. He normally cooks breakfast and I cook dinner. So he's not really into sugar like that, like I am. So he'll put just a little bit of syrup on my pancakes. Now back in the day, I remember I used to saturate it, and I'm like eating it and still adding it on there as it absorb it, because I don't want no dry pancake. But now, I'm first of all, since it's been a long time since I've been able to even eat pancakes without getting the sugar kind of buzz. Now that they have the protein 100 whole grain pancake, they don't bother me. I can eat one and be okay, and just put just a little bit of syrup on it. Okay, so just enough so you can taste a little bit of the sweetness in every bite of pancake. Okay, and then another thing that and then another thing that I've been drinking that has a sweetness to it is this tea that I get from Costco. It's like a lemon ginger. I can't remember. It's a lemon, like a lemon ginger honey lemon ginger tea, and it tastes. I love it. I love that tea. I crave it probably because it's sweet too, but it has real lemon in it. You have to actually, when you're drinking it, I think I probably need to strain it, because when I'm drinking it, I'm having to take out the lemon parts of the lemon out of my mouth. So that part is irritating. So common sense, I think I probably should try straining. How do I strain it though? Because it comes in a jar, a big jar, and it's like it's not liquidy. You have to add it to liquid. It's kind of like a gelatin kind of texture with lemon, and it has like a honey color, honey honey color. Yeah. And I just heat up some water, and then I put it in the tea, and I mix it until it blends. And it's not real, it's not thick, because once it blends, it's almost like having tea and you just put lemon in it. So, and I just refrigerate it, just to keep it fresh. And it lasts me a long time, a long time. So that's all the sweet that I've been allowing myself to have. Besides having coffee, which I should not be drinking. And I've been trying to but I have cut back a lot on coffee. I do get like the chai tea latte. I like that with the oat milk in it, or the pistachio latte. That's one of my favorites, the pistachio, and it's seasonal. So I reward myself during the season, and I get me some pistachio latte with oat milk. So yeah, I told on myself. Um, yeah, every now and then I'm still doing latte is still considered like a coffee, right? I don't know. But anyway, so that's what's been going on with me. So for the pre-diabetes, all the doctor is telling me just to I need to eat healthy. I need to eat healthier. So I've been working on that, and I've lost 8 pounds. I lost 8 pounds. So yay! I'm gonna keep going, and I know where the weight gain and is coming from. It's from me eating junk food, grazing, eating junk food. I'll go all day and not eat a meal, but it's the meals that will really fill you up and give you the fuel that you need. All right, so hit the subscribe button, make a comment. What do you think about um, what I've talked about with my health, the different issues. What are your thoughts? What is your experience? I'd love to hear it. All right. So that was me, Ross, just checking in with you guys, or you guy, or whoever, guy, you gal, or I might be just checking in with myself. Anyway, so thank you so much for whoever is watching or who will ever see this video. Um, I will update as soon as I find out some more information on my condition. Okay. All right. God bless you. And remember this one thing: when you don't know what to do and the doctors don't know what to do, don't worry, because the Lord knows what to do. He is the great physician. Okay. And his ways and his thoughts and his mind is perfect. It's never wrong. The Lord don't make mistakes. Okay. He created us, and he knows every cell, organ, enzyme, blood vessel in your body, because he created it. Okay. It goes far beyond, well, my mama made me. Well, who made your mama? Who made your mama's mama and your mama's mama? Okay. All of that has got to lead to one deity, and that is Jehovah God and his son Jesus Christ, God the Father, God the Son, and God the Holy Spirit, God's almighty power. All right. All right. So that's it. I'm going to lay my sick self down, get ready to take my other antibiotic. All right. So take care of yourself. If you have some type of symptoms or anything going on with your body, most times we know our bodies. Okay. Push and advocate for yourself, and make sure that you are um, playing an active role in your own um, medical care. Ask questions of your doctor. Do your own research. Okay. So be active, um, active, active member of your care team. Okay. Because after all, it's your body. All right. You're the one that has to live in that body. You are the one that has to suffer in that body. All right. All right. I'll see you guys next time. Bye. Go push the button, Roz.